You connected to the Physical Health channel from Dr. Potter. I am going to talk about today the use of resistance band for the legs. And this very neat band that you find it nowadays with a series of them have different in intensity, tension of the bands actually. And the color changes from manufacturer to manufacturer. And so you're gonna follow whatever the guideline it is from the lightest to the strongest. For the exercise I'm going to show in here today that I like the band because it's nice and thick. It doesn't cut in the skin when you're putting on the leg. And we're going to use it for a very low level of strengthening for your legs. And so you want to start very light because otherwise you're going to create too much muscle tension into your gluteal region, and that can actually upset a little bit of the sciatic nerve, and we don't want that, okay? If you don't have good balance, you should be sitting for this to put the band around the ankles. And I have good balance, so. And you can put it either above the knee or down to your ankle area. When you're doing down to the ankle area, is harder exercise because of the length of the lever arm or length of the leg. So harder one is lower, easier one is above the knee. Okay, and you can use any level you want it. So the first thing that I like doing it is just leg spreads. If you don't have good balance, you're just doing side steps. If you have good balance, you just open the leg in the air. I'm going to increase the intensity a little bit because this is way too easy for me. Just about half mid-calf. And I like how it kind of stays nice and move it. So you want to pull the abs in, always to maintain good posture, and then open the leg to the side. And if you don't have good balance, you do a side step, or you use hand support and you open the leg in the air. Alrighty? So this is the first level with hand support or a side step. We're gonna do 10 times to your left. And I recommend that you always count aloud, so that way you're breathing properly. That will be 5 and 6 and 7 and 8, 9, and 10. And if you notice that I actually did not put my foot down the whole time, so that's the highest level that you can do. And of course you can close your eyes, which will make it even more difficult because it makes you really think about what you're doing. And then it's really difficult to keep your eyes closed and open. But only when you have good balance and you want to challenge yourself, you can close your eyes, take the vision away, and it makes you work a little bit harder on your balance exercise at the same time you're working on the strengthening. So that would be 5 and 6, 7, abs in the whole time, 9 and 10. The second movement we're going to do is a forward kick with hand support for the people that are not able to, or putting the foot down each time, or step forward and come back. 8, 9, and 10. So you make the level that you want to do it, and the other side as well. 1 and 2, 3, 4, 5, 6, abs in the whole time. 7, 8, 9, and 10. And the last movement is actually a back kick. A couple things that you want to keep in mind when you kick into the back. You don't want to be arching in your back, or you want to be diving like this, like a duck. So it is a small motion. So abs in with hand support or not, do a small kick and back. You're gonna feel that gluteal muscle engaging in here as you're doing those back kicks. 3 and 4 and 5. Abs are engaged, so it protects my back. 7, or step, tiptoe, back and back. And then switch to the other side, either tiptoe or kick, step back, put the foot down each time, or make it difficult and keep the leg in the air the whole time in single leg balance on the other leg. 9 and 10. So this is the hip band exercises that I recommended for the lower extremity. A couple other things we can do. Of course, we can always do side walks. Your knees are going to be slightly bent like you're gonna be doing pushing somebody back, well, like a football, and you're doing side steps and back, step and back. And you do about 10 times in one direction, and then 10 times to the other direction. What you don't want to see when you're doing it, when you're doing a sidewalk, you don't want to be doing this, okay? And you don't want to be locking in the knee, okay? So you're doing a side step, and you don't even, if you don't have a long pole, you do step to the right, come back, step to the left, and come. And you're just keeping that a little bit tension, alrighty? And you can do back step, forward step. And the next one I call the monster walk, which is very wide base, knees are bent, abs are in, and you're keeping that walking. And I usually say walking like a cowboy. And you're going back and forth 10 times in each direction. Those are the standing part of the exercise that we're doing. If you're not able, because it's too difficult, keep everything above the knee and it will be easier. The neat thing about when you're doing resistance on your hip muscles, especially the abductors or the external rotators, we're getting that nice squats with externally rotating the leg. What I love about these exercises, that you're actually helping a very special part of your body, which is the pelvic floor. So if you're having issues with losing urine when you cough and sneeze and laugh, and you're having difficulty engaging your pelvic floor muscles the right way, you want to start with this exercise. Because when you're doing resistance, the pelvic floor engage as well when you're doing hip work with resistance. And that way you can help your pelvic floor to start some of the strengthening part of it until you're able to doing more of voluntary activation of those muscles. So enjoy the video, use it as a guide for you to have some ideas to strengthen for your hip area. If you're having issues with SI, low back pain, hip pain, knee pain, ankle issues, you should be doing some strengthening for your lower extremity. And that's it for today.